Most people believe that regular health checkups are always beneficial. But what if I told you that once you reach a certain age, some of these tests might actually endanger your well-being? It may sound unbelievable, but it's the reality. Not every screening is harmless, especially as you get older. In fact, many of the most widely recommended health exams for seniors can result in misleading results, unnecessary anxiety, and even risky procedures. This isn't fear-mongering, it's a reality that more and more healthcare professionals are now confronting. Especially when treating patients over 70. Medicine is slowly waking up to a new truth: generic testing for all ages can cause more harm than healing. In this video, we'll explore 5 specific medical checkups older adults should consider skipping. These are tests that many experienced doctors avoid for themselves. We'll uncover the reasons behind their popularity, the hidden threats they carry, and smarter alternatives that safeguard your well-being without endangering it. If you're someone who values your health but also wants to avoid excessive treatment, unneeded medication, and the chaos of modern healthcare, this message is for you. Let's dive in. Small Blue Diamond 1. The colonoscopy dilemma. Colonoscopy has long been seen as the gold standard for catching colon cancer early. But beyond age 70, especially for individuals without symptoms or a family history, this exam can be more damaging than protective. What used to be life-saving in your 50s and 60s might, after a certain point, bring stress, danger, and even hospitalization. The procedure isn't easy. It includes intense bowel cleansing, sedation, and insertion of a camera deep into the colon. That's hard on younger bodies, but significantly harder on older ones. Seniors are especially vulnerable to dehydration and mineral imbalances from the prep process. The sedatives may also linger in aging systems, causing confusion, dizziness, and higher fall risk. Worse, minor findings like small polyps, often harmless and extremely slow-growing, can trigger a chain of unnecessary follow-ups. Surgeries. Biopsies. Repeat scopes. Sometimes even partial colon removal. For someone in their 70s or 80s, those polyps may never have posed a threat. Let me share a story. My friend George, 82, was active, clear-minded, and symptom-free. He was persuaded to get a routine colonoscopy. During prep, he became dangerously dehydrated. After the procedure, he was disoriented, fell that night, and fractured his hip. Months of rehab followed, and they found nothing during the test. The point isn't to criticize doctors, they're following what they were taught. But healthcare must evolve. If you're over 70, symptom-free, and had passed clean tests, it's completely acceptable to decline a colonoscopy. Today, there are non-invasive stool tests, safer, simpler, and effective. Better care doesn't mean more procedures. It means smarter choices. You're not avoiding care by being cautious, you're respecting your body. Small Blue Diamond 2. The full body scan trap. A full body scan sounds like the ultimate preventative move. A machine scans you head to toe, exposing hidden dangers. What could be smarter, right? But for people over 70, it can cause more harm than good. CTs and MRIs are powerful, they detect everything, including benign abnormalities. These incidental findings rarely matter but often lead to panic. A spot here, a nodule there, and suddenly, you're on a roller coaster of follow-ups, biopsies, and surgeries. For older adults, these follow-ups aren't trivial. A biopsy can collapse a lung. Recovery is longer. And lying still in the scanner can be tough on stiff joints. The emotional toll is often worse, constant worry about things that might never matter. I recall Betty, 78, full of life, walked daily, no complaints. She took a cheap full-body scan offered at a health fair. They found a tiny kidney lesion. Panic took over. Within weeks, she was in surgery. Months of recovery followed, and complications she never shook off. The term is overdiagnosis. It doesn't help, it harms. Full scans aren't covered by insurance unless medically necessary. Most seniors pay out of pocket for a test that often leads nowhere helpful. Instead, seniors should focus on symptoms and how they feel, not every shadow on a scan. Not every image deserves your attention or worry. Backhand index pointing right if you're finding this helpful, comment number 2 below. And don't forget to subscribe so you never miss valuable insights like these. Small blue diamond 3. The misuse of cardiac stress tests. For decades, treadmill stress tests have been used to detect heart issues in older adults. Push the heart, see how it responds, simple, right? But after 70, that logic can backfire. These tests often produce false positives in seniors. Age changes the body, arteries harden, blood pressure swings, and heart rhythms vary. The machine flags these natural changes as problems. That leads to a domino effect, more tests, angiograms, even surgeries. Each of those comes with major risks: bleeding, kidney damage from dyes, dangerous blood pressure drops. A treadmill test can lead to a hospital bed, fast. Like George, 74. No symptoms. Just a routine checkup. His doctor suggested a stress test, just to be safe. That test led to a stent, which led to a serious infection, and 6 months of recovery. Many top cardiologists today don't recommend routine stress tests for symptom-free seniors. No chest pain, no shortness of breath. Skip the test. Instead, focus on lifestyle, walking daily, eating well, staying connected, managing stress. That does far more for your heart than wires and machines. Aging wisely means saying no to tests that add risk but no real value. Small blue diamond 4. The hidden costs of repeated colonoscopies. The fear of colon cancer runs deep. It's often silent until it's advanced. That's why colonoscopies gained fame as vital tools. But after 70, the risk-benefit balance changes. Sedation becomes risky. The aging brain is more sensitive. Confusion, memory issues, and brain fog are real concerns. Then there's the bowel prep, massive doses of laxatives that dehydrate and throw off your body's chemistry. That dizziness you feel. That fall risk. It's all real. And here's the part most overlook: colonoscopies are designed to prevent cancers that take 10 to 15 years to develop. If you're already in your late 70s or 80s, and had clean past results, those polyps may never harm you. But complications from the test could. Eileen, 78, had clean colonoscopies at 68 and 73. At 78, her doctor insisted on another. Her colon was accidentally perforated during the procedure. Emergency surgery followed, and her energy never returned. She says now, "I wish someone had warned me." This isn't about fear, it's about informed decisions. If there are no symptoms, and you've had clear screenings, skipping another colonoscopy is often the safest choice. Backhand index pointing right if this resonates, comment number 4 below. Your input helps keep this conversation going. Small blue diamond 5. Reconsidering routine heart stress testing. Heart issues seem sudden, so we feel safer checking regularly. But routine stress testing in older adults with no symptoms is often not helpful, and can even be harmful. These tests detect natural aging changes, not always heart disease. The result? False alarms, anxiety, stents, surgeries. Like Harold, 76. Active, healthy, no issues. One stress test led to a stent. The stent led to blood thinners. The thinners caused internal bleeding. Harold spent months recovering, all from a test he didn't need. Top cardiologists now agree, only test if you have symptoms. Not every small change needs investigation. If you're feeling good, moving well, and have no discomfort, your body is already giving you a better signal than any machine. It's time to shift from aggressive testing to thoughtful observation. Aging well isn't about chasing diseases, it's about guarding your peace, independence, and vitality. Getting older doesn't mean giving up control, it means gaining wisdom. We live in a system that glorifies more tests, more pills, more procedures. But sometimes, doing less is the boldest, smartest choice. Not every scan or test is necessary. Many won't change your outcome, but they can change your life, your energy, and your peace of mind. Before saying yes to another procedure, ask. Small blue diamond, will this change how I feel? Small blue diamond, will it improve how I live? Small blue diamond, or is it just routine? You have the right to choose thoughtfully, to be informed, and to protect the time and energy you've worked so hard to earn. Thank you for spending time with us. If this video helped you see things differently, comment below and share one insight that you're taking away. And if you haven't already, please like, subscribe, and turn on notifications. Your support helps us keep sharing content that respects your age, your health, and your wisdom. We'll see you in the next one.